The deadliest brain cancer on Earth has a strange weakness. It consumes enormous amounts of sugar to survive. Glioblastoma is such a brutal brain tumor for adults. You know, even with all the treatments, sadly, survival is still incredibly short for most patients. It's truly devastating. Otto Warburg found cancer cells gorge on glucose, even with oxygen. Weird, huh? Normal cells usually rely heavily on efficient, oxygen-based energy production. Cancer cells often switch to rapid glucose fermentation instead. This became known as the Warburg effect. Today, it is recognized as a major metabolic feature of many cancers. Glioblastoma appears especially dependent on glucose. The tumor grows rapidly and demands massive amounts of energy. Standard treatment focuses on physically removing and damaging tumor cells. Surgery, radiation, and chemotherapy remain the medical foundation, but the cancer frequently returns. One reason researchers investigate metabolism is because treatment often does not directly target the tumor's fuel demands. This is where the ketogenic diet entered scientific discussion. The diet sharply lowers carbohydrates and shifts the body toward fat metabolism. As glucose decreases, the liver produces ketone bodies for energy. Healthy brain cells can adapt to using ketones remarkably well. Some glioblastoma cells may struggle to use ketones efficiently. Researchers believe this metabolic mismatch could potentially stress tumor growth under certain conditions. Early laboratory and animal studies suggested ketogenic therapy might slow tumor progression. That sparked interest in testing the idea alongside standard care. A 2010 glioblastoma patient used a keto diet. Their tumor really responded. Usually, outcomes are awful, right? However, a single case report is not proof of a cure. Researchers viewed it as a starting point for larger clinical investigation. Scientists figured less sugar, insulin, and stress might slow tumors. Okay, more recent trials have focused mainly on safety and feasibility. Researchers want to know whether patients can tolerate the diet during aggressive cancer treatment. Keto's okay with a doctor. Fatigue and tummy troubles are common, all right? Keto studies look super promising for survival, but we're still waiting, right? Keto's not a replacement, okay? It's just a helper with other treatments. Not every tumor behaves the same way metabolically. Scientists are still trying to determine which patients may benefit most. The big idea? Starve tumors, to really weaken them, not just attack. The Warburg effect was discovered 100 years ago. Researchers are still learning how to turn that metabolic vulnerability into a real therapeutic weapon. Let me know if this is the first time you've heard this story. Comment first and share your thoughts.